Welcome to Healthy Living with Diabetes. My name is Elizabeth O'Neill. I'm a registered nurse and a certified diabetes educator. I work at UCLA in the Department of Diabetes Education and the Department of Endocrinology. Today I want to give you an overview of diabetes education and invite you to make an appointment with one of our many UCLA diabetes specialists that include endocrinologists and certified diabetes educators. Over 30 million Americans are living with diabetes. Throughout this presentation, we'll be revisiting this slide from the CDC, which summarizes steps that you can take to live well with diabetes. These steps are healthy eating, physical activity, diabetes medications, healthcare appointments, checking your blood sugar, and knowing your diabetes ABCs. My hope is to give you some tools to take control of your diabetes, improving your health, and help to reduce your risk of developing diabetes-related complications. First, let's start with an introduction to diabetes. So what is diabetes? So diabetes is a condition defined as high blood sugar or hyperglycemia. This happens when the body does not make insulin, as in type 1 diabetes, does not make enough insulin, and does not use insulin properly, as in type 2 diabetes. As of 2015, over 30 million people, or 9.4% of the US population, had diabetes. Approximately 1.5 Americans are diagnosed with diabetes every year. Clearly, this is a healthcare crisis, but there are many things that you can do to prevent or delay diabetes. Or if you are living with diabetes today, there are many things that you can do that will help you lead a healthy life with diabetes. And at UCLA, we're here to help you. Let's look a little closer at what is happening in the body when someone has diabetes. When you eat, let's say an apple, your body digests the apple and converts it to glucose or sugar. Glucose is used as energy by our body. When glucose enters the bloodstream, the pancreas releases a hormone called insulin. Insulin takes the glucose from your bloodstream and helps it enter the cells of your body so that you can function, walk, talk, live your life. When someone has diabetes, the pancreas may not produce insulin at all, such as in type 1 diabetes. It may not produce enough insulin, or the insulin that it produces is not working properly. When this happens, blood sugar levels in the body begin to rise. And the problem with this is that high blood sugar acts as a poison, and over time, this can lead to diabetes-related complications. When blood sugar is out of control over a period of time, you are at a greater risk for developing serious diabetes-related complications. As I mentioned in the last slide, high blood sugar acts as a poison and attacks the body. This can lead to blindness, kidney failure, heart disease, stroke, and loss of feet, toes, and legs. So let's look back at our CDC slide and look at the first item on our list, healthy eating. The CDC recommends that everyone eat more fruits and vegetables, less sugar, and less salt. When it comes to healthy eating, I want you to remember that there's no such thing as a diabetic diet. You can still eat your favorite foods. It's about making healthy choices and watching your portion sizes. Eat more vegetables, eat more whole grains. Decrease your intake of processed foods, fast foods, and high-fat, high-sugar, high-calorie foods. Limit your intake of fruit. Yes, fruit. Desserts and sweetened beverages, and drink more water. There are many ways to maintain a healthy diet. At UCLA, we encourage you to meet with one of our diabetes educators to discuss healthy eating. We teach carb counting and how to fit foods into your diabetes plan for success. But today I'd like to talk a little bit about the Healthy Plate Planner. As you can see here, I encourage you to rethink how you build your plate. Start with adding non-starchy vegetables to half your plate, such as steamed broccoli or a salad. Add some lean protein, such as fish, to a quarter of your plate. In the last quarter of your plate, add a high fiber carbohydrate, such as brown rice. You can add a healthy fat, for example, a small amount of avocado, but keep in mind that these have high calories and you want to limit them. Don't forget something to drink, and we definitely encourage water and greatly reducing your intake of sweetened beverages. When it comes to non-starchy vegetables, we're filling half of our plate with these. They do not raise your blood sugar, so add them to the biggest portion of your plate. Non-starchy vegetables are an excellent source of vitamins and minerals and great sources of fiber. Here are some examples of non-starchy vegetables: asparagus, broccoli, cabbage, cauliflower, greens such as collard greens, kale, lettuce, mushrooms, radishes, zucchini. Remember, you can have them cooked or raw, fresh or frozen, and don't forget to spice them up. Carbohydrates are converted to glucose or sugar when our body digests them, but not all carbs are created equally. We need carbohydrates in our diet, and it's best to spread them throughout the day. High fiber carbohydrates will give you more bang for your buck, leading to a slower rise in your blood sugar due to higher amounts of fiber. Some examples are whole wheat bread versus white bread, brown rice versus white rice, beans and lentils, oatmeal, and whole grain unsweetened cereals. When it comes to carbohydrates, you want to consider your serving sizes. So add your high fiber carbs to a quarter of your healthy plate. When we're talking about carbohydrates, let's not forget other carbs such as fruit, milk, and sweets. These fall into this category. As I mentioned earlier, when you have diabetes, you can still eat the foods you like, but when it comes to these items, please limit your portion sizes and also limit the frequency of how often you eat these. One trick is to eat them with protein. For example, maybe you eat a small apple with some almond butter. This will slow down the release of the glucose into your bloodstream. As we've been talking about, portion sizes are very important. So when it comes to these items, fruit, milk, and sweets, choose them in small amounts. You might also consider how often you're eating them. Are these items that you're reaching for every evening, or are they for a special occasion? Let's talk a little bit about protein. Protein does not have much of an effect on blood sugar, but for heart health, we want to consider how much fat is in our protein. Therefore, we recommend lean protein added to the last quarter of your plate. Here are some examples: fish, such as cod or tuna, poultry. It's better to choose white meat such as chicken breasts or lean ground turkey. Greek yogurt, non-fat or low-fat, eggs, low-fat cottage cheese, peanut butter, nut butters, tofu, and tempeh. Last but not least is fat. So fat doesn't raise our blood sugar, just like protein, but again, we really want to think about good heart health. So we want to choose healthy fats. Here are some examples: avocado, nuts, olives, olive oil, seeds. But one thing to keep in mind, all fats are high in calories, so watch the amount that you put on your plate. Lastly, when it comes to healthy eating, it's important to look at your portion sizes. As mentioned earlier, you can meet with a UCLA diabetes educator to learn carb counting and to get recommendations on carbohydrate targets. But in the meantime, let's look at portion sizes. Sadly, over the last 70 years, portion sizes in the United States have greatly increased, leading to obesity and adding to the risk of developing type 2 diabetes. Here are some examples of smarter portion sizes, and you can measure them by looking at your hand. So for example, when you're looking at those high fiber carbohydrates, if you look at the size of your fist, that's approximately the amount that you'd want to put in that quarter of your plate. The size of your palm and the thickness is about the size of a piece of meat or fish. A handful of nuts 2 handfuls of popcorn. The thumb is about the size of that healthy fat, whether it's almond butter, and the tip of the thumb would be something like cooking oil, such as olive oil. Next on our CDC slide is physical activity. It's recommended that you aim for at least 150 minutes of physical activity every week. So what are the benefits of physical activity? We know that it lowers blood sugar. It helps the insulin in your body work better. It uses it more efficiently. Physical activity also lowers blood pressure and improves circulation. It can improve your mood and decrease the symptoms of depression. It burns calories, leading to weight loss. It improves stamina and flexibility, and it can help you lead a longer and a healthier life. The American Diabetes Association recommends at least 150 minutes of moderate physical activity per week. So what is moderate physical activity? Well, moderate physical activity is anything that gets your heart rate up. When you're doing physical activity at a moderate pace, you can still talk, but it would be difficult to sing. Another tip, not on this slide, but especially if you spend much of your day sitting, is to get up and move for 3 minutes for every 30 minutes of sitting. When you are looking at physical activities, you want to try and find activities that you're going to enjoy. Choose a time of day that works for you and start slow and work up to more vigorous activities. And it's important to speak with your physician first before starting any sort of physical activity routine. But remember, keep it up because practice makes perfect. There are lots of different types of physical activity. Aerobic activity builds cardiovascular fitness. It lowers your risk of heart disease and stroke, and it helps in weight loss. Some examples: walking, dancing, bike riding. Strength training helps to build muscle, boost metabolism, and helps to maintain weight loss. Some examples are lifting weights, squats, push-ups, and using resistance bands. Flexibility training will help you reduce your risk of injury. It increases your core strength and it can help improve your mood. Some examples of flexibility training are yoga, Pilates, Tai Chi, and stretching. Next, I'd like to talk about taking medications. Taking diabetes medications are in addition to healthy eating and physical activity. There are many different diabetes medications taken by mouth, some are taken by injection, by pumps, and some are even inhaled. Just remember, everyone is different, and it's important to work with your healthcare team to determine which medications are best for you. And even if you're doing everything right, as time passes, your need for medication and different diabetes treatments may change. There are lots of different options available to you. Here are some tips for success when it comes to taking medications. Know what medications you take, what they do, and when to take them. Keep a list of your medications with you at all time, including name, strength, and directions. For example, metformin, 500 milligrams twice a day, and make sure to bring these to all of your medical appointments. If you have trouble remembering to take your medication, put the medication in a place where you do other activities. For example, place your medication next to your toothbrush. If you have any questions about your medications, please ask your physician, your pharmacist, or diabetes educator. Make sure that you take your medications as directed and on time. If you need help with these, you may want to talk to a family member about helping you remember or setting a reminder on your phone. Any of these things will help you be more successful in taking your diabetes medications. Another key to living well with diabetes is making and keeping medical appointments. If you're living with diabetes, going to the doctor is very important. There are routine tests that you should have regularly. At every medical appointment, please make sure that someone measures your blood pressure. Have your weight checked. Have your physician examine your feet, especially for sores. Every 3 months, have a blood test called the hemoglobin A1C. We'll talk about the hemoglobin A1C in a moment. Every year, you should have a wellness checkup or a physical. You should also have blood and urine tests to check for kidney function, or more frequently, depending on the recommendation by your physician. In addition, every year having a blood lipid test is important that includes total cholesterol, LDL, HDL, and triglycerides, and a thorough foot exam. When you have diabetes, other important medical appointments are dental checkups, recommended to be twice a year, a dilated eye exam to check for diabetes-related damage that may occur in your eyes. Get an annual flu shot to keep you healthy during cold and flu season, and a pneumonia shot. This will also include other recommended vaccinations. Let's talk about checking blood sugar. The American Diabetes Association recommends for most people with diabetes the following targets. Before a meal, less than 130. 2 hours after meals, less than 180. These numbers vary based on a person's age, their health, medications, and the healthcare provider's recommendation. So these numbers may not be your numbers. It's important to speak with your healthcare provider if you're unsure about your blood sugar targets. A lot of people wonder, why should I test my blood sugar? Well, testing your blood sugar gives you vital information about how well your diabetes is in control. It gives you information about how your blood sugar is affected by what you eat and drink, the physical activity that you do, how illness affects your blood sugar, stress, and your diabetes medications. It also helps to identify blood sugar levels that are dangerously high or dangerously low. So it's important to check your blood sugar. Lastly, on our CDC slide is the importance of knowing your diabetes ABCs. By keeping your diabetes ABCs under control, you can significantly lower your risk of developing diabetes-related complications, such as heart attack and stroke. So what are the diabetes ABCs? Well, A is for A1C, or hemoglobin A1C. The A1C is a blood test that measures your average blood sugar over the past 2 to 3 months. The American Diabetes Association recommends for most people with diabetes an A1C of 7 or less. Your A1C goal will depend on many other things, such as your age and other medical conditions. So it's important that you test your A1C approximately every 3 months. B is for blood pressure. Maintaining normal blood pressure helps to prevent damage to your eyes, your kidneys, your heart, and your blood vessels. And this helps to reduce the risk of heart disease and stroke. The American Heart Association recommends a blood pressure goal of 130/80 or less. Test your blood sugar at every health care appointment and at home if recommended by your provider. And lastly, C. C is for cholesterol. When cholesterol levels are too high, the blood vessels become narrowed and clogged, which can lead to heart disease and stroke. Cholesterol goals are for a total cholesterol less than 200, for your LDL, which is also known as the bad cholesterol, less than 100, HDL, which is the good cholesterol. For men, it's less than 40, and for women, less than 50. And your triglycerides level, less than 150. Make sure to have your cholesterol checked at least once a year. Last but not least, let's talk a little bit about healthy coping with diabetes, something that I think often doesn't get enough attention. You may struggle with your diagnosis of diabetes, and that's normal, because managing diabetes can be overwhelming. You may worry about taking care of yourself with diabetes, or taking care of other people. You may worry about making healthy food choices, being physically active, checking your blood sugar levels, and other decisions about your health. Managing diabetes can feel like a second job. When all of this begins to feel too much to handle, you may experience what we call diabetes distress. This is when worry and frustration and burnout make it really hard for you to take care of yourself. If you're feeling diabetes distress, please don't dismiss it. Pay attention to your feelings. Talk to your healthcare providers about how you're feeling. Allow loved ones to help. Talk to other people with diabetes. At UCLA, we offer free support groups for people and their family members living with diabetes. Do one thing at a time. You don't have to be perfect. And pace yourself. You don't have to meet your goals immediately. Just keep working toward meeting your goals and don't give up. If you have a day that didn't go your way, pick yourself up, brush yourself off, and decide that you're going to try again. This is about you and living your best possible life with diabetes. And remember, at UCLA, we're here to help you. There's a whole team of us here just for you. And one more note, you're invited to attend our 5th annual Healthy Living with Diabetes Conference. This will be an inspiring, empowering, educational event. Some of the highlights include blood pressure screening, one-on-one talks with our diabetes specialists and experts who will address a variety of diabetes-related topics that I think you'll find very interesting. The event takes place on Saturday, March 2nd, 2019, from 8 a.m. to 12 p.m. It will be held at the UCLA Medical Center in Santa Monica, specifically the Conference Center. Free parking will be at the Arizona parking structure. Participation is free, but pre-registration is required because space will be limited. To register, please call 1-800-516-5323. I hope you found this presentation on diabetes helpful. We encourage you to contact UCLA's diabetes program. Just look us up on the UCLA Health website. We look forward to helping you live your healthiest life with diabetes. Thank you.